Hi, everyone. Welcome to Family Matters. Today, our topic is really going to discuss the care of a person struggling with a cognitive or mental disorder and how it can create significant ups and downs. Sometimes a caregiver feels helpless and out of control. So, today, you're going to learn ways to self regulate during these stressful caregiving situations and hopefully learn some strategies to increase the efficacy of interventions. So today we are joined by Bobbi Duffy, who is our COO and CCO of Counterpoint Health Services, which is an interprofessional behavioral healthcare company specializing in geriatrics and dementia care. Bobbi has over 30 years of experience in healthcare, 18 years practicing geriatric psychiatry as a nurse practitioner, and has been with the team at Counterpoint for 20 years. Welcome, Bobbi. We are so glad you're here.
Thanks, Abby. It's good to be here, and I'm glad we're talking about this topic because it impacts everybody who touches caregivers, whether they're paid or family. It impacts them to such a great degree. And the coolest thing about the topic is there are ways to reduce your internal stress.
Mm-hmm. For sure. So let's just jump right into it. This topic can be very meaningful to those caregivers out there who do have loved ones with a cognitive impairment. So I'm excited to talk more about it. Can you
Great.
first give me an example of a situation that may create an emotional response in a caregiver?
So I think that if we asked for a situation and we asked 10 people, we would get 10 different priority answers. So as a general thought, some of the things that really trigger caregivers can be what seems like a very basic, not important thing that can be extremely important. And that could be as much as not being recognized by your loved one. It could be rejection. It could be negativity. So many different things. You know, the one example that I often will use is, and I'll try to give you the scenario as briefly as possible, is, you know, I'm the daughter of Joan, and Joan's always been a gardener, but now she's in assisted living and doesn't have that opportunity, and she loves daisies. So I've been growing daisies just so I could bring her a bouquet of them. And I bring in the bouquet, and my mom says to me right away, she goes, "Daisies die so fast." Like, boom, pop the balloon, inflation out. And the initial response for a lot of people is to go, "Mom, I've worked on this so hard. Why do you have to be so negative?" Instead of being present for a moment, and just taking a breath and realizing that an initial response does not have to be the end all for that conversation.
Yeah, so an emotional response could be positive or it could be negative
Sure.
for sure, depending on the situation. So when it is negative and a caregiver or a loved one is triggered, what's the first thing that they should do?
So this is easier said than done, and gets easier with practice. The first thing to do is to pause. It's to just take that second. And a pause for humans, especially those of us living in the United States, a pause is very short. We are go, go, go. So it's take the 2 seconds. The next thing on that I really encourage is a deep breath. And that deep breath does not have to be obvious to everybody else as if it's a sigh. It's just enough to re-regulate our body. So pause, breathe, take a minute there. And in those moments, as you practice this, you'll be able to regroup. So you're not totally knocked off your lane. You're able to regroup and kind of continue with the interaction. And then if it's appropriate, re-engage.
Okay, so just taking a minute, taking a breather, just stopping, assessing the situation. So then after they've taken, a few seconds and they've paused, they've taken a deep breath, is the next step to look for any kind of immediate safety concerns?
Absolutely.
Okay, so really taking a look around, what do I need to do first? Kind of triaging the responses.
For sure, for sure. So safety is always first. So If, in the example I gave, if you walked in and mom attacked you and threw the daisies back at you and the glass broke, your immediate concern would be to get mom away from the glass, not even to pick up the glass. But so we're going to immediately deal with safety concerns, and safety concerns kind of throw out our responses to a degree, so taking a deep breath and pausing at the time would not be appropriate. But also being realistic about the safety concerns. If someone yells at you, the safety concern is relatively low. Is there a risk of physical harm to your loved one or yourself? And you count too in safety concerns. So generally, check safety, but it is unlikely to be a major issue unless someone's physically agitated.
So once the situation has passed and settled down, wouldn't the pause make the patient or the adult a little bit more upset? I could see how that could be how you're ignoring them. So can you kind of touch on that a little bit further?
I think that is a great question. I think that's almost our first instinct. But one of the things is that in the situation, probably both people need a pause. So you're offering the pause. So it creates a situation where it's a moment or a couple of seconds to regroup. On the other hand, it's often not really even noticed. The person may not notice they're caught up in the daisy dying too quickly or something else. They're in their own thoughts. So most people are not aware of other people's behaviors or reactions as finely as to notice a brief pause. The other benefit of a pause, besides offering a reset, is that science has shown us that we have what's called mirror neurons. And those are special brain cells that actually experience what you're seeing in many cases. So a pause can actually trigger a pause in somebody else, or at least the experience of a pause in somebody else, which is a pretty cool thing and pretty well-founded and researched.
So, and that also brings up another point too, is, a lot of times when these behaviors are occurring, it could be in an adult with a cognitive impairment, and sometimes allowing just a few seconds pause, they may forget why they were even initially upset. So that's even another benefit that occurred to me. But speaking of that mirror effect, is that a benefit of maintaining calm and non-reactive during a stressful situation? Could the patient mirror that as well?
Mm-hmm. I don't think it will work as intensely as we would hope it would, but it can dial it down. I kind of think of it as, just like a graph. And if we're at this level intensity and we're at a 9 intensity and we can bring it down to a 7 or to a 6, then what happens is there's so much more pliability for a positive interaction. When you do this, we think better. We think better when we take that pause.
Okay. Yeah. I think it just benefits everyone overall.
It really does.
Yeah. And once the situation has passed or at least settled down a little bit, how does the caregiver kind of move on and get over it? The caregiver is the one without the cognitive deficits or anything going on. So how do they move on?
And it's important to remember that you do need to do some work to move on. Walking away from the situation, going home to your friends and rehashing it, especially rehashing it over and over, will likely not be beneficial. What you want to do is go and have a conversation with someone you trust. And if you need to have multiple, that's fine. But to just be in the pain of the moment, rehashing a situation really equates to reliving it. So we're creating it in our mind again, which was painful the first time. Why create more pain moments for ourselves? So talk about it with somebody you trust to kind of evaporate that steam. Review. And you don't have to do that with someone else. You can do it with yourself. You can think, okay, at what point was this that I started to feel that tingle of annoyance or that irritability? What was it that triggered me? And be vulnerable. Be willing to say, ooh, wow, that wasn't fun. When I was growing up, mom always criticized my gardening. It brought me back to that. And it doesn't have to be that deep as you'd imagine in a psychotherapy session. But if you can get glimpses of what really sparks that, you're giving yourself power to avoid that or adjust that in the future. Remembering, take nothing personally. Most of the time, any of our reactions, my reaction, your reaction, the patient's reaction, is about us. It's not about the other person. And so take nothing personally. Be willing to praise yourself, to say, wow, you did that better than you did last time. Give yourself grace on the times you don't do it better than you did last time. We're humans. It is as good as it gets for us. We're human. Try to learn from it. And then if it's something that's like just rolling and rolling in your head, consider using one of your coping strategies. And some of that might be get on your bike and go for a ride, or open a book you like to read. Try to get away from the thinking, rethinking it. And I love to say this is rehashing is reliving, and we want to avoid that.
Yeah, so those are excellent strategies and probably easier said than done. So,
hands down. Practice, practice, practice.
Practice, practice, practice. Exactly. So you mentioned in there some self-insights as being an empowering tool. Can you give an example of an insight that can be learned and utilized over time in challenging situations?
Yes. I think my favorite one is that being emotionally uncomfortable will not kill you. That is absolutely one of my favorite things. It is not a threat to your safety. It's not a threat to your survival. It is okay to be emotionally uncomfortable sometimes. I also believe these are the moments we grow the most, being uncomfortable. So they'll become a window into you if you allow it. If you just say, oh, that stunk, I'm not going to forget that. I never want to think about that again. You miss the opportunity to learn. And as you begin to pay attention to how you respond to situations with your mom in the assisted living, or if you're a paid caregiver with somebody else's grandma in the assisted living that you're trying to help bathe, as you become aware of your responses, they'll infiltrate all parts of your life and make it easier when that drive-through lady at Wendy's is rude because she forgot to catch up.
Yeah, so that's a way to apply it to everyday life,
everyday
right?
life. Everyday life.
Yeah.
And it's our experiences are very driven by what we see and what we feel. So these life practice, I call them life practice situations, strengthen us. A brief example is, it's raining outside. I have about 10 choices surrounding that. I could be miserable because I can't get out for a walk today. I could be upset that I'm looking out my window at a gloomy day, or I could say, wow, doesn't that sound pretty? Or that's I don't have to pay for water to water my lawn today. And you can hold both these thoughts in your mind at the same time. But trying to look at things a little differently will really change how we feel throughout the day.
Yeah. And so that leads me into the next question. And that's, you mentioned all of these strategies that caregivers can do to help prepare for themselves to go or to kind of reflect on the situation. What did I learn from this? What did I take away? And maybe they're talking to someone to help improve their ability to cope and manage. What if they know that their loved one is upset and it could be a potentially confrontational or stressful situation? What can they do to prepare to help them anticipate of what's going to happen?
For sure. So I think it's important to be aware of, based on our historical engagements with people, we want to be prepared. This may or may not go how I want it to go, but it may go okay. So always be open to how it plays out. Also know that remember from the beginning, even if you're anticipating a negative interaction or something that just doesn't feel good, remember the true value of what you're doing. So, for a caregiver that's paid, that might be, okay, this resident of mine is going to be, after the bath, is going to feel better. They may not like the bath, but there's going to be a positive outcome. They're going to feel better. They're going to feel clean. For the daughter who brought the daisies to the mom, bringing the daisies, when she's there, when she's gone for the visit, and those daisies are on the desk, the mom may look at them and go, wow, my daughter brought me these, or may remember recall sometimes when she was gardening and enjoyed gardening. So remember that the positivity of the outcomes of the situation are not always clear in the situation when you're uncomfortable. Good things happen afterwards. Be prepared to pause, to breathe, to recognize, and come from a direction of love and kindness. It keeps us sane. Nothing is personal. Do not forget that.
Yeah, those are great strategies. So we really have time for just one more question. So I kind of
Sure.
want to wrap up, and I hope that you can give maybe 3 or 4 key points that you would like our listeners viewing in today, some takeaways that they can do immediately in a stressful situation. So just kind of to wrap up, just a couple of key points.
For sure. If you are willing to face being uncomfortable with an open mind, you will learn how to change your internal experience of a situation in a few seconds. You will learn those skills. Breathing is your number one friend. A deep breath changes your physiology and your body chemistry. What I've said are too much. Nothing is personal. And uncomfortable moments strengthen you.
That's great. Thank you so much.
Thanks, Abby.
Bobbi, thank you again for taking the time to share your expertise with our families listening in. This was a really great topic, and I know that's going to hit home for a lot of our uh, families tuning in. So, thank you, everybody, for tuning in for Family Matters, and stay tuned for our next episode. Thank you.
Thanks, Abby.